Well, hello, everybody. This is Dr. Ellithorpe with Tustin Longevity Center. And we are here in Tustin, Southern California. And we do this every week, 6 o'clock to 7 p.m. We have a program where we call it Ask the Doctor Anything. Now, I'm a medical doctor, standard trained, and I've practiced medicine for 44 years roughly since the late 70s. And I have had all this experience in alternative, complementary, functional medicine. Even before I became a doctor, my dad was in food research. So I'm kind of like a dinosaur in this. So that's why we say ask the doctor anything. Doesn't mean I have the answer necessarily. I will give you my best, shooting from the hip response from all your questions. But this is meant to be educational. This is not meant to be a personal management for your specific question if your questions are about yourself. So if you have a medical condition or concern, please see your local doctor. If we are your doctors here at Tustin Longevity Center, please call the front office and make a follow up so we can address any issue that may be going on with you. And of course, if these are urgent things and we can't get in to see you, you have to see a urgent care or the ER if these are very serious questions. But in general, we do this for educational purposes, and we'll take any question, and we'll get to see what we think as a practicing physician, standard training with all this functional medicine background, decades and decades of experience. So let's start. We have the email, and we have some still left over. I've had so many live questions, and I tend to do the live questions first because if you're here and watching, I want to on the YouTube, you can type in chat, type in your questions, and then I'll look and see if those are popping up new. I'll answer those first. Okay, so we're having some live questions already coming in. And the first one is from Christina. And she says, "Hi, Dr. Rita. What do you know about gingivitis and periodontal disease? How can you reverse it naturally?" Well, we Americans tend to eat very high sugary, high fructose corn syrup laced foods, whether it's ketchup or our salad dressings or going out for a treat. It's everywhere. And so those sugars feed the growth of bad bacteria essentially, and that will build up in your mouth. The other thing is that bacteria makes acid. The metabolism of the life of the bacterial cell will secrete its waste materials, and that's acid. The acid then will erode the enamel on your gums, and that enamel then will let the inner part of the um, uh, tooth, the dentin, be then dissolved away by this bacteria and the acids they make. Now, what I would say is we're eating too many hours in a day because we have so much food available. It's easy to just call up a phone number or text, and you have DoorDash drop food off at your house. Pizza deliveries, all kinds of ways of getting this in. Every time you chew your food, you're getting micro trauma to your gum line. If you don't eat a healthy diet and get enough protein and fat in your diet, then the cell membranes that make up all the cells to your gums will not have the building materials to repair it as fast or well as someone who is not eating so much sugar, who eats mostly healthy fats and proteins, and has a lower bacterial count because they're not feeding their gut, their mouth bacteria with so much sugar, starch, rice, and that includes rice, beans, potatoes, yams, all the starchy carbohydrate foods. What are the things then, in particular, to think about? If you're a blood type A, A's as a general class don't digest proteins and fats as well. And most of the A's populate what would be the vegetarian, vegan type population because it's harder for them to digest fats and proteins. So they naturally gravitate to that area. they would then always be eating a higher starch carbohydrate diet, and they would always have then a higher count of this bad bacteria all the way through their gut. And that has impacts for their longevity and health. So we talk about certain supplementation. If you're a blood type A, take a digestive enzyme. Everyone learn to try and eat in a restricted window of eating time, uh, preferably 6 hours, and then the rest of the day you're in a state of fasting. That allows for bringing any starch and sugar down to stop feeding this bacteria that is being grown around and everywhere in your gut, but in particular at the gum line. The other thing is there is research from, let me see if I have a copy here. All right, here we go. Nothing like live, huh? There is what are the dental studies on Juice Plus, the periodontal disease. It's the most researched nutraceutical in the world. And I'm trying to find the places where they've studied the nutrition on the teeth that actually showed the pocket, where they see how deep the pocket is into the teeth, gum line there to the tooth, was reduced with this. And I'm trying to look and see if I can find that. One was in London at the medical school there. So I'm looking in particular at the British School of Dental Health. I don't see it right off the bat, but there's 2 studies on seeing the superior dental, oral, reduced periodontal disease, and less depth of the pockets in your teeth there. So that's in the research item of the Juice Plus story. So I would say you need to get a soft brush. You need to probably use Juice Plus. You probably should be on vitamin D. You should probably eat a richer protein fat diet, more in the meat, fish, chicken, turkey, beef, and egg world. Not eat late. Flossing is very important. And when you floss, instead of going up and down, I would put the floss in and then just pull it through, and then put the floss through and then pull it through. We're finding in research that going up and down hard like that is harmful. So anyway, when I did the doctorate in integrative medicine, there were a lot of biological dentists back in the 1990s when I did my doctorate in alternative medicine, functional medicine. And they were talking about that as well and seeing the value of the antioxidants and flossing and a soft brush, not a medium or hard bristled brush, and a low carb diet and richer protein fats in your diet. All right, the next one is Christina added, do you think a deep clean is a good thing or no? My dentist wants to do a clean, and I have only heard bad things from a deep cleaning. I don't know that I know enough to give you an answer on that. I just had tooth surgery. I had to have one root canal taken out, and I shouldn't have put it in the first place, but you know, what are our excuses? We're always chasing our tail, working, and it came upon me quickly. My neighbor is a dentist, so I ran to his office, and that's what he did. And so we just live our lives with our choices. But it went bad shortly, and then I just had the tooth pulled. Before I did that, I had a very good cleaning. In general, I had good teeth report, but I had to lose that one tooth that had the root canal. And I'm very glad I had it. And I do actually feel better. So I'm going to say I don't know for sure on deep cleaning. I think we have to focus on sugar because if you look at the work of Preston Price, who was the dentist in the 1920s when they first came out with the small box cameras, Brownie cameras, this dentist went around the world by ship. And he went to islands and faraway places that had no civilization. And he looked at the smile and the dentition of the natives. And these people were not getting a high carbohydrate starch diet. And they had beautiful teeth formation. They didn't have this narrow palate, and they didn't have overbites or underbites. It was quite remarkable, and there was very low sugar. So Weston Price Foundation was made. Sally Fallon, I think, is the president of it. Sally Fallon, Fallon. And you can go to their site right now, the Weston Price organization. Look at the dental work that really says your diet is what makes your teeth healthy. And so the low carb diet is foundational, eating rich protein and fats. And many of these cultures didn't have toothbrushes or anything like that. I remember my own grandfather, which had a lovely set of teeth. He, when was he born? 1895 or something like that. Anyway, he was German. And he would tell me that the only thing they got was a very hard, dried out piece of bread. And he would eat this hard bread and it would kind of scratch and clean his teeth. Well, anyway, bread's a carbohydrate. That's not good. But they had such little food back then. So uh, I think the low carb diet is the key, and Weston Price is where you should go look for more detailed answers. Gwendolyn says, "Hi, Dr. Rita. I love your new bangs." Oh, thank you. All right. Well, I just got tired and I thought, well, what the heck? I'll cut a few bangs here. Thank you. And then she goes on to say, this is also in the email questions. I'm a 41-year-old female, and we're considering trying to conceive again. How long should folic be taken before trying, and should I and when to discontinue? Well, folic acid, B12, the B vitamins are rich in a carnivore diet. So you wouldn't have to take it if you ate meat and fish and eggs and bacon and pork and salmon, all this kind of stuff all the time. It prevents neural tube defects. And so this is one big thing, and I'm glad they do it. The OBGYNs talk about getting folic acid and B12. So good for them on that. But, to have a healthy baby, your body has to know you have enough protein to create a whole being. And we're made of protein and fat. So moving towards a more carnivore-like diet is the number one way to support pregnancy. I have seen research on hundreds and hundreds of Juice Plus babies and OBGYNs that have studied women who have had Juice Plus, including the ones that I had. And Juice Plus provides the rich polyphenols, antioxidants, plus the B12, folic acid, all those are in there. And I tell all my women who want to get pregnant and those who are with pregnancy or just found out, I have them on Juice Plus. Because the babies born in the studies I've seen, and my OBGYN who have had their patients on Juice Plus, they have a better birth weight. They have less need for C-sections. The babies have better APGAR scores. Far less often they need to go to the NICU. They just are better oxygenated babies, and I would definitely be on Juice Plus. Then we give all our women who want to become or just learn they're pregnant, I give them vitamin D, at least 5,000 international units with K2. The third thing I give all my women who are pregnant or just found out is iodine, iodoral, 12.5 milligrams a day. And then I put them on a multi-mineral vitamin, Mitocore, TLC Energy Core. those are the four things, and this is extremely superior to any cheap prenatal vitamin that's out there. And a rich protein fat diet. In fact, we used to boil eggs at Cook County Medical Center in the 1970s, 1978, I think it was. Yeah, 79. We made all these hard-boiled eggs for the under the more poor girls that couldn't afford healthy protein, and this stopped their nausea. So anyway, the babies are made of fat and protein, and you need to eat a lot of it. You have to have the antioxidants. If you take a good multivitamin mineral, that will also have the folic acid and B12 in it. If you take Juice Plus, that will have folic acid and B12 in it. Multi minerals, because those are cofactors, and that's in the multi mineral vitamin. And then if you take the iodine, better intellectual knowledge, better IQs are reported with adequate iodine, and we're all deficient in iodine in our diet. And then the last thing was vitamin D, and that is also associated with your immune health and better IQ, that kind of stuff. So that's what I would do, Gwendolyn, and just relax. And I do believe that you should stay on these good things. So I'm in my 70s now, and I'm still on my Juice Plus. I'm still on my vitamin D. I'm still on my iodine, and I'm still on my multi-mineral. So just stay on those and don't stop them. Hopefully you'll breastfeed too. Gwendolyn asks, chelation IVs continue. I've chelated pregnant women. Mothers detox into their babies. If you look at the cord blood compared to the mother's peripheral venous blood, there's much more heavy metal in the cord blood. So I'm all in favor of mothers chelating themselves before, during, after pregnancy. It's quite safe. In fact, we give toddler babies chelation therapy if they accidentally chew lead-based paint, and it almost kills the babies. They get neurotoxic and GI toxic from a little tiny chip of lead-based paint, so it's quite safe. She goes on to ask, should she continue Pro-Serenity over-the-counter progesterone days 15 through 28 of her menstrual cycle? I'm all in favor of progesterone days 15 through 28 of all girls. It's such a stressful world. Stress, cortisol makes follicle stimulating and luteinizing hormone blocked. That stops ovulation and pregnancy. So yeah, I'm in favor of it. Any suggestions for trying to conceive at my age, especially blessings? Well, there's the older you get, the less eggs are ready to be available for ovulation. So a woman at 40, 41 will probably only really ovulate every few months. So you only have maybe 4, 5 opportunities a year now. You want to take the rich antioxidants to keep them healthy and strong. Water, absolute. I should mention that you should take very good water, half your weight in pounds as ounces every day. And I would also tell you that the window of getting pregnant is roughly day 7 from your menstrual cycle. So if day 1 is the first day you start bleeding menstrually, 7 days later is when the body is about ready to recognize that it can ovulate. And so follicle stimulating hormone will start about a week after the start of your period. And that will pulse and come out to try and ripen a egg and to get it to mature, and then have a corpus luteum cyst to produce progesterone. And that window is from day 7 to 15 of a menstrual cycle. So it's your second week from the start of your period, so day 7 to day 15 roughly, that is your highest probability of having a successful pregnancy. So I would be intimate with your husband from day 7 all the way through day 15, 16. And I would use the progesterone only after day 15, because progesterone too early will is the basis for birth control. Synthetic progestin is produced and made to trick the body to think that you already ovulated and to have economy and save the eggs. You stop ovulation by giving a fake progestin, but there's a risk of higher cancer with it. The Women's Health Study of 2002 July came out, and it was actually the progestin that was the only thing associated with increased breast cancer, not the estradiol estrogen components. So take your natural progesterone, which is totally different than the progestin synthetics. Take that day 15 through 28, and you should get pregnant because God is on our side. He wants us to be fruitful, and so you're obeying his commands. Praise the Lord on that. Let's see. Can deteriorating eyesight at age 41 be reversed? I just started wearing reading glasses for the first time. That's really a function of the cornea, and rather your lens has little ciliary muscles. And when you want to look at something close up, like reading a book, your little muscles will either pull that lens and thin it out, or relax and let that lens get spongy and big. So to help the light focus on the back of your macula to get vision, it is the depth of the lens, whether you're going to have a thick lens or a thin one, whether you look far or you look close. And going from far to close vision requires that sponginess. So if you drink enough water, you eat enough protein and fat so you can make even your little tiny ciliary muscles, so exercise, and eat a low carb diet so you don't get them sticky and hard like hard candy with a high sugar carbohydrate fruit sugar diet. Take a wonderful antioxidant like Juice Plus, the most researched one, and you can then help to prevent things like cataracts, macular degeneration, and so forth, glaucoma. EDTA chelation helps it. So I'm in my 70s and I have no cataract, nothing forming on my lenses. I do chelation at least 10 times a year, at least. And I do that every year. So every 3 years, I've done 30. Every 10 years, I've done at least about 100 IVs every decade. So I've been chelating, reducing oxidative radicals for my body, improving my microcirculation, even to my little ciliary muscles. But as far as the lens, I don't think it will change much. What you want to stop is the cataracts, macular degeneration, glaucoma. And then, great is thy faithfulness asks, will the food sensitivity test tell me if I have sensitivity to lectins or oxalates? Yes, the answer is yes. Leah says, just wanted to say thank you for our visit today. Oh, Leah. Okay, wonderful. I feel like there is hope. We have been praying for the right help. Sorry to bug you here. No, it's no bug at all. I mean, the whole idea is to be available. Okay. But thank you. Leah stays wonderful, wonderful, lovely patient and her husband I met today. I think doctors are getting told a lie. They think that they're going to make a big difference by becoming a specialist. And actually, what we need are 8 general, family, internal medicine, pediatric doctors for every specialist there is. So there should be 8 primary, functional doctors for every 10 out there, because we need to keep you healthy. We need to be in one place. We need to get to know you, your family, your situations. We need to understand your unique body, your blood type, your social situation, your work demands. All this goes into how well you'll be. Stress will hurt your immune system. Cortisol will suppress ovulation, and so it goes. So this little program here is hopefully to create another venue for general questions, to let you know I'm not going anywhere, Lord willing. And if the Lord allows me, I will stay working until one day I die. And I have this number in my head of 112, which makes me think of I was listening to the news, alternative news about um, Social Security and how they're finding people who are, uh, I don't know, millions and millions, way high beyond what you would expect, that are in their 90s, and multiple millions in their hundreds, 110 to 119 millions and millions. 120 to 129 millions and millions, 120, 30 years old to 139 years old, hundreds of thousands, 140 to 149,000, or 149 years old, hundreds of thousands. This is so ridiculous, getting Social Security. So, it's being washed out and laundered, and something is rotten in Denmark. The old expression about cheese, something is rotten in Denmark, and that's they're making a lot of cheese, wonderful cheese. But we have allowed this government to get so big we can't supervise it, and smart little people there have figured out a way to hide crime and theft and stealing. So if I get to be 112, it'll be because I really am working and alive. But I have the wonderful privilege to tell you I'm so blessed. I have a patient last Sunday called me, and she invited me to her 100th birthday. I had a gentleman invite me to his 90 something birthday. So I'm at that age now where I'm here so long that my patients are becoming 90-year-olds and 100-year-olds, and functional, walking, talking, well thinking people, meaningful lives. What a gift that is. So if you can get a hold of anyone at Social Security, you go tell them Dr. Ellithorpe's got the highest number of older functional people who use the least amount of Medicare and are the longest lived. So hallelujah, we thank the Lord for that. And that's just fun news. I was so blessed to get that news. Well, thank you, Leah, for saying that. Sharon says, thanks for continuing to spread the word on the wonderful health benefits of the natural healing benefits of the carnivore diet. Yeah, I hope and pray that all your patients realize the truth. Yeah, this is protein and fat. Everything I'm grabbing on here, this is protein and fat. And it's not made of sugar, carbohydrate, starch, because that crystallizes like hard rock candy, and you couldn't be soft and lovely to touch, and so forth. Sugar is really not a essential nutrient. There's only essential fats and essential amino acids. Carbohydrates, there are none. Let's see. Charlene says, thanks for continuing to spread the word on the wonderful health. Yeah. Second thing, can you talk about the advantage of carnivore or very low carb diets for children, please? Well, essentially, your baby is living on the fats and proteins to make their structure. And so your baby is living on a rich carnivore like diet with proteins and fats. When you breastfeed your baby, that's a very rich protein, fatty item for them to be consuming. It's very natural to raise children up on a very rich protein diet: meat, fish, chicken, turkey, pork, eggs, uh, and so forth. I don't think we need dairy necessarily. Of course, humans are the only ones who really past infancy consume dairy in the mammalian kingdom. But yes, it's very natural. It's very healthy. It is very brain healthy. It is very immune healthy to consume a great deal more of healthy, natural, grass-fed, prairie-fed, wild-caught protein, whether it's fish or meat or chicken with the skin on it, pork, eggs with the yolks, and so forth. Kaylin just says hi and thank you. Hi, Kaylin. Good to see you. All right, so we've got some free time here from our live questions. Brian says, this is old. This is 3 weeks old. Happy New Year, Dr. E. A recent urine challenge test revealed outside the reference levels for barium. I had barium swallow test 6 months ago. And of course, barium is a heavy metal. So when the radiation is shot at you on those x-rays, the barium will absorb it just like the calcium in your bones, so that we will see the outline of your bones and then the barium that you're swallowing. So yeah, you'll pick it up. Um, so outside the reference levels for barium, also cadmium, cesium, lead, mercury, nickel, thorium, and uranium. And by the way, on uranium, when I was back here in 2011, that's when in March, Tokyo, Japan had that 9.1 earthquake and the tsunami and Fukushima radiation exposure. And it was by June of 2011 that the jet stream was dropping down on us. And that also goes for China dumping on us. You know, China is producing, I don't know, 2 to 10 new coal fire factories for their 1.5 billion people. They don't obey any environmental protection laws. And so here they're building many per month of coal fire power plants with no control for clean coal emissions, and it goes in the jet stream and it dumps here. So in Fukushima, by June of 2011, I saw the uranium levels go up on all my heavy metal toxicity studies, just to let you know how egregious this is. And so it says here, my doctor recommends 30 chelation treatments. Will monthly treatments be sufficient? If so, what kind of results should I expect? Now, Brian, I don't know your size. I don't know what other toxic behaviors or work environment you do. I don't know if you're a smoker, vapor. I don't know if you do the hookah. I don't know what kind of work, if you're dealing with soldering or electronics. But given that you're a standard guy is probably not doing any of these real toxic jobs, then I'm going to say even once a month, because each chelation has value, because it lowers your body of a total burden of all those metals. That's why I love chelation EDTA, because it is a universal chelator, including mercury. That's why it came out in the urine that you did. I'm an old time doctor. I've seen hundreds, yea, millions of chelation results in people. And with that, I have seen mercury go down, aluminum, arsenic, cadmium, lead, uranium, all of it, because it's a universal chelator. It's probably the best. Now, it's designed mostly for lead for children. So that's how it got its FDA approval in the 1960s for childhood lead toxic exposure from the paints and the crib paints and stuff. But if you do once a month, you will benefit, because everyone matters that you do each chelation. But you'll be just doing it slower. Now, I don't know how old you are, Brian, but if you just keep on doing this like I have, I've probably done at least 300 in my life. Maybe that's why I have still color in my hair. I have a vibrant health. My blood pressure is like a teenager. My labs are good, I think, because I exercise, drink water, and eat a very low carb diet. But given that, yes, you will see the results go down, but you won't see as deep, as fast a drop with monthly chelations as you would with weekly chelations. So if your doctor is not as experienced as me, the changes that you'll see after 30 months, if you're doing it once a month, will not be as dramatic, but you will see droppage. And we just have to show every breath you take in, every piece of food you eat is contaminated from the airplanes, geostratospheric engineering. Watch the documentary called The Dimming. All these things are contributing to our bioaccumulation of this oxidatively damaging toxin heavy metals, and there's many, and it's hurting our children, our babies. So you just have to try and get a doctor to look at it with experience, but hang in there, stay with it. I tell my patients to do it lifelong. Even if you can only do, let's say you did your 30 or 60, and all you do is for a year thereafter. Wonderful. That's going to benefit you. The next question is from Damien. She says, hello. She says a nice thing for me. I won't read it here. Why do you think Biden pardoned Dr. Fauci yesterday? So this was from January 21st. Okay. So he did that on the 19th. She said just before Trump's inauguration, what are they trying to hide? If you're not at liberty to discuss this issue, I understand, and you can disregard my question. Blessings to you. Um, well, he is responsible for the past, since 1984, being in charge of NAIAD Institute and involved in the gain of function research, aware of the ban on it in 2014, disregarding it, getting legalese, slimy lawyers using language twisting to try and justify it in other language, going out of country to do this, taking taxpayer money unlawfully in a enemy country where they use the military Chinese medical research departments, and everything is militarily controlled. You don't have a business in China that is not controlled or supervised by the Communist Chinese Party. And so you put all that together, and the harm, because it was predicted in the report of 2016 by Ralph Barrick, and him reporting that they had found the coronavirus now able to affect the human lung tissue in 2016 published. These guys knew what was going on. Everything has now been turned around and proven with research and exposure of the truth regarding the sourcing of it is most assuredly likely a lab source. Whether intentional or an accident is less clear. They had been in error about the COVID would stop transmission. Now we know it did not stop transmission. They also then said it would prevent you from acquiring it. Now we know that did not prevent you from acquiring it. You did acquire it. So just about everything they said, including the masks and the distancing, you put all that misguided information when we can actually show him saying the reverse years ago about how if you get a flu or a viral illnesses, that's the best way to get a immune system in your own body working. And to hear him just years recently say, no, that isn't the best way, the double talk. And all that put together makes him culpable in his role of leadership for misleading for the health of the nation and so many other nations. And yes, I think this should be seriously investigated and let the facts fall where they go, and let the outcome that the facts and the law prove, let the just judicial management of it be commenced. Is that what you wanted me to say, Damien? I hope that justice is done. I don't want anything that is not just to happen to anybody. Okay, we're getting more live messages here. Let's see. My sister Debbie said hello. Hi, Debbie. There she is. Here is a joke. Okay, my sister brings me jokes. All right. My older sister, she's 3 years older. What do you call a train carrying bubble gum? A choo-choo train. Debbie, that's a dad joke. And I'm going to have to tell it to my grandson. What do you call a train carrying bubble gum? A choo-choo train. Thank you, Debbie. All right. Kaylin says, my family and I are looking for a heavy metal detox. I would go to a doctor that does EDTA chelation IVs. Okay, it's the most wide breath penetrating. I've been doing this and around chelation since I was 7 years old with my grandfather, and he had unstable angina. He couldn't even be at rest without chest pain getting to him and is scrambling for his little nitroglycerin tablet to put under his tongue. My father in food research had learned about EDTA chelation in the Chicagoland area where the Great Lakes Academy for the Advancement of Medicine from the original cardiologists in the 1950s who saw the benefit of chelation in their cardiovascular patients with angina. And so my father got it from my grandfather. I witnessed it as a child, and grandpa lived long enough to see me go to medical school. And so, what I was 7 when I witnessed him clutching his chest. So, what? That's uh, 10 plus 4 is 14, another 15 years of life when he had unstable angina and there was no other treatment back in the 1950s. Give me a break. So there you go. Yeah, I would do IV chelation. The oral ones like zeolite and volcanic ash and high dose lipoic acid concentrations, Solentra, um, garlic, chlorophyll, all these have chelating capacities, but nothing to the level of EDTA chelation intravenously. And JFK Jr., who's the head of the HHS now, he wrote on his approach for his role with President Trump prior to the election. His statement was he wanted to see chelation therapy uh, recognized because we doctors have been doing this since I've been doing it since the 1970s. All right. So, and there's hundreds of millions of IVs given, and it's the safest thing to do. And we have the healthiest, long lived patients. So it's time to get this on insurance and covered. Oh, but they don't want to pay your insurance. Maybe that's the reason. They don't want you to live much past 65. Maybe that's the real reason why they try and tell you not to do it. Okay. Uh, Kaylin says, we found this product. Would you recommend? Uh, well, you didn't say the name of the product. Or is it heavy metal detox? If it's, I don't have any support for over-the-counter oral chelating having any long-lasting impact. It may help, and it will help what's in your food at the time. So I'm not saying don't do it, but if you want to have an impact on your blood vessels, you're going to have to do IV chelation. Great is thy faithfulness says, I heard there was another recent TAC trial too. Are there any new updates? I have to look into that. Now, TAC trial 2 was for diabetics in large part. They saw such a value on diabetics improve. So I don't know the exact outcome, or I haven't seen the publication. Of course, you wouldn't get the publication because they suppress all this stuff. But ask me next week. I should have more of an answer because I meant to do that myself. Is there a third trial plan? I think there is TAC trial 3 also ongoing. That's for peripheral vascular disease, mostly done by orthopedic doctors because they saw such wonderful improvement in saving people from amputations. And if it can save you from an amputation, folks, then it can help your brain blood flow and think better. It can help your eyeballs to see better. It can help your heart pump better. It can help your skin look better. Maybe one of the reasons why I have better skin is from all the chelation. I do have one thing people will often say to me is that my complexion has always been good. So that's another thing with Juice Plus. They actually had dermatology studies, biopsies of the skin, and the blood vessel flow dynamics were enhanced in those who use Juice Plus. So that may be it also. Another one, Vita says, question, share some more Indian Asian winter season raw diet for better gut health, liver ulcer issues. Indian Asian winter season raw diet for better gut health, liver ulcer issues. Um, I prefer that we start with looking at what your blood type is. If your blood type is A, you have to use digestive enzymes, whether you're going to eat raw or vegan. You have to find out your blood type. My other suggestion would be um, to be vegan or to be vegetarian, you have nutrient deficiencies. So I cannot support vegan, vegetarian lifestyles. To do so, you have to work very hard to balance the heavy starch carbohydrate load with trying to get enough nutrients in your diet. And then you have to supplement with B12 and certain other nutrients that are very low. Fat soluble vitamins tend to be very low. So I am in favor of supporting, we're made of protein and fat, not fruits and vegetables. Fruits and vegetables contain micronutrients and minerals and starches that we can extract and use, but largely they are not a essential nutrient. We don't need any carbohydrate, starch, or fruit sugar. None. We need excuse me, fat, healthy fats and protein. So that's my recommendation there, Vita. Um, Going back to these questions here. Um, Teresa says, good morning. I left this question on your YouTube. Have there been any advancements in the treatment of Peutz-Jeghers syndrome? Pietz Jaeger, Jegers syndrome. Peutz-Jeghers syndrome. You diagnosed my daughter a few years ago with it. She is 11 and doing well now. Thank you, says Teresa. That is a situation in which often you'll see a big freckle, a brown or blue freckle on the oral areas and or nose, and I saw that on her daughter, and I asked her about having her pediatrician look and see if she had a lot of polyps, because Peutz-Jeghers syndrome, there's a lot of polyps in the colon, and that then is associated with increased risk for GI cancers. So she had it looked at and managed, I guess. So we praise the Lord for that. And thank you, Lord, for helping me remember this. Now, this is a genetic scenario. It is not something that you ate or anything, but it is promoted by a lifestyle of junk food. So you don't want to eat a high carbohydrate, fruit sugar, high fructose corn syrup, sugary drink foods. You want to eat a low carb rich protein, meats, fish, chicken, turkey, beef, eggs, fish, shrimp, lobster, crab, and cooked vegetables that are low carb vegetables. And we thank the Lord for that. I would have any child on the Juice Plus. I would have any child on extra vitamin D and iodine. For sure. Find out her blood type. If she's blood type A, she needs digestive enzymes. Get her to a good functional pediatrician or doctor. She's 11. We start seeing people here in their teens. So Stacy says, or here, I jumped over one. T asks the question, what can help cure squamous cell carcinoma on the top of the head of an 87-year-old male? It is now bulbous, no longer flat, diagnosed 7 years ago or more. We aren't oncologists. We don't treat cancer here. We try and build up the immune system to defend against the progression of cancers or start of cancers, their initiation. There are things like black salves that have been out there. When you look at these over-the-counter products, you'll see that they're composed of items that are just plant hyper-concentrated polyphenols, which are powerful antioxidants. And that is what is applied to the skin cancer. Antioxidants are helpful, but there is no study or research that I can go to that can look at this. Now, maybe with JFK out there, and we can get some forward-thinking doctors to design a reasonable cost study on topical cancers, skin cancers, to dermatologists and give them these high antioxidant polyphenol concentrate salves every day to the area would be a reasonable thing. Um, but I'm not a specialist in oncology. I don't treat cancers. I try and work with the oncologists or with the specialists to help my patients support their immune, nutrient, dietary, and detoxing patterns. And they usually do very, very well. So that's what I would say about that. Stacy says, "Hello, Dr. Ellithorpe. I've been diagnosed with osteoporosis in one hip and now use the treadmill and do leg presses regularly. I have also started stomping like you're an angry kid, jamming your feet into the ground, stomping like you're in a tantrum, doing that, half a minute once a day or so. Um, what are your thoughts about using a vibration plate? Thank you. Well, it mimics, and the same thing with a rebounder, it mimics the sudden deceleration that a force against a fixed entity that will create a vibration on the periosteum attached to the bone that creates a what we call a piezoelectric signal through the periosteum to the bone osteoblasts that basically are saying we're alive, turn on, build, grow, repair, reform, remodel. Okay, so those are people who take a very good amount of vitamin D. What's a very good amount? My standard over the many decades is roughly 10,000 international units a day with vitamin K2, at least 90 micrograms, sometimes 180 micrograms, along with a low carb diet and rich in protein fat. That's where you get all your calcium and minerals, and stomping and exercise, weight resistance training. That is what we do along with natural hormone replacement therapy, estradiol, and progesterone. And that is what we do. And we have so many of our 80-year-old and 90-year-old women with normal bone density here. It's so cool. And oh, by the way, the lady who is having her birthday that I was invited to at 100, she's still on her natural hormone replacement therapy. And so there she goes with her hormones. There you go. And her mind is sharp as a tack. Jessica says, have you ever seen anybody clear their congestive heart failure through EDTA chelation? The answer is yes. There's many causes that bring about congestive heart failure. One of the ways they used to treat heart disease before they had heart surgery, open heart surgery, heart transplants, coronary artery bypass grafts, stents, all these kind of things, and some of these medications, is they use testosterone because the heart is a muscle. And by getting enough DHEA, that will help raise up testosterone. Plus, you can prescribe testosterone. And along with that, with a very low carb diet, time restricted eating stimulates growth hormone repair. And those growth hormones help repair the heart and the tissues all throughout the body. Intermittent fasting promotes that, like eating a 6-hour window and only eating breakfasts and lunches and omitting all dinners and having at least 16 to 18 hours, maybe even 20 hours of fasting and eating in a 4-hour window. That stimulates stem cell growth hormone repair. Another thing is, of course, the chelation improves the microcirculation, which will get the stem cells, the growth hormone, the testosterone, the waste removal there. And so, yeah, and then I would be on a powerful antioxidant like Juice Plus. And yes, I've seen it turn it around. The answer is yes. Gwendolyn, we talked about that's the one who said she had the pregnancy, wanting to get pregnant at 41. Katharina says, I did my first EDTA chelation a couple of weeks ago. This was from the 28th, so that would have been mid-January. And although I had no flu-like symptoms, because when you move toxins out of your body, you can get what we call a detox flu, Hershmeyer reaction. as you're pulling toxins out. Some people feel a little flu-like, achy, tired uh, afterwards for hours to a day. And she goes on to say, I had no flu-like symptoms, but I felt like I had difficulty thinking, buzzing feeling. Well, that's part of the flu-like symptom. When you're having a flu, you don't think so well. Hard to put my thoughts into words. I did try to drink a lot of water, but it lasted well into the next day. Should I go down in dosing? No, Katharina, I already have a low dose there. I use my chelation, and all the years now I can use 50 milligram per kilogram, which is typically closer to 3-gram infusion. But that's when you get more side effects of the flu-like achy detoxing. So I use the other end of the recommendation, 25 milligram. So about 1.5 grams. So there's no confusion, no risk, very, very limited flu-like detoxing phenomena. So that's what I do. So, Katharina, just do it the way it is. That's my suggestion, or talk with your doctor about it. Constance says, what is the best thing to do at the onset of a cold? Fast, stop eating, drink water, take vitamin C. I have my buffered vitamin C right here. I take my buffered vitamin C and I will open up a capsule. In fact, I'll do one after I'm done here. I just put it right onto my tongue. So, starve a cold, feed a fever is the old grandma statement. So, the minute you have a cold, stop eating. Just drink. You can have chicken broth, you can have beef broth. Do that for 24 hours. Take extra vitamin D. I have the 50,000 international unit vitamin D. I take one a day for 5 to 7 days. So I build up my vitamin D. I fast at least the first 24 hours. I drink extra water. I rest or take it easier for that day. I'll take more systemic enzymes to reduce inflammation on my empty stomach because I'm not eating that first day or so. And then I will take my multi-mineral that has the zinc in it. 25 milligrams is in my TLC multi-min, but I do that every day. I might take more though. And then I open up these capsules of my buffered vitamin C so I can put, 1,000 milligrams on my tongue, swish and swallow. And I just do that continuously. In fact, every 30 minutes until I'm feeling much better. And then for the stress of it all, I take my methylated B complex. And then I take usually my Argentine silver 23 parts per billion up my nose. I take a sip, gargle, and I swallow it. Those are things that I do with a cold. Jessica. No, who was it? That was Constance asking that. Okay. Is it best to fast on warm liquids? Not necessarily, but it's nice. That extra humidity of the heat of the fluid does go up into your nasal sinuses, and that will help loosen up mucus congestion. But if you're drinking a lot of water and you're spraying it with the Argentine and you're taking the systemic enzyme, that will help to decongest you. Todd says, I recently watched a documentary called The Dimming. Yeah, I just brought that up earlier in the program today. I was not aware that our government regularly experiments with cloud seeding and other practices that release toxins like aluminum into our atmosphere, which eventually makes its way to the ground level where we breathe and drink into our bodies. Are you aware of this? How can we detox? Do EDTA chelation for this. It pulls out the aluminum. And of course, look into all those vaccinations that the kids get and all the aluminum that is in them. And some of them still have mercury. I think the multi-dose flu vaccine still has mercury in it. That's my understanding, but I'm not 100% sure. Yeah, so do EDTA chelation therapy, Todd. And yes, I've been around when I was a flight surgeon on active duty, and I was in command of the airfield at Gotham Airfield next to Fort Knox, where they're going to audit the Fort Knox. I used to know one of the uh, guards that guarded Fort Knox. I can't say his name. I don't want to dox him, but I was so tempted to ask him if he really saw gold in there. And his wife was my friend. She was my patient on active duty. And I just have made friends with my patients throughout my whole life. But Charlie could never tell me about the gold at Fort Knox. Anyway, yeah, so I had the airfield, and the airfield is right there. If you look at the news about Fort Knox and you see an aerial, you'll see a landing strip there. That's where I would land the helicopters and the fixed wings, but mostly helicopters, because all the pilots back then in the 70s, 80s had to, all the doctors who became flight surgeons had to also know how to fly. And so it's just funny to see that in the news and say, I used to land on that thing with uh, so forth. Anyway, I had fun flying in a F4 jet. At that point, we never landed there. The landing wasn't long enough for it. But C-130s, the big ones. We had the U-21s, two wing fixed wings. Just had a lot of fun. I had a lot of fun flying in the fighter jets, and I threw up all the time. I know the men didn't like having females in the Army as a flight surgeon, so I was one of the earliest ones. And they would do aileron after aileron after aileron, and I would just throw up and throw up and throw up because I knew it was going to happen. And after having all my babies, I had a hiatal hernia, and so even if I stopped eating 8 hours before, something would always come up into my throat. So I'd have to take my air mask off and then vomit and then put my oxygen back on, and it was just terrible. So I was ordered to be a flight surgeon. I never asked for the job, but it did give me more of a 9 to 5 job so I could be home with my little toddler children much better. So there were some benefits to it. So all that about the documentary, The Dimming, it's true. I know that they were doing this even back in the 70s, and I know they started something even earlier than that. I know in Vietnam, President Johnson was bragging about he who controls the weather with geostratospheric engineering will control the world. And I think the very first geoengineering flight was in 1927. So, all right, so it's after 7. I've gone 2 minutes over. Praise the Lord. I've had fun today. If this is of value to you, please hit like and subscribe. Please share this with your friends and family. And then we'll see you next week on Tuesday at 6 o'clock. So God bless and take care, everyone. Bye-bye.